President Trump appears to be working to end talk of a feud between members of his administration and Dr. Anthony Fauci. It comes as at least 41 states report an uptick in new coronavirus cases. That's causing some governors to roll back their reopening plans and increasing pressure to require people to wear masks in public. 25 states have now had a mask mandate put into place. Two of the nation's hardest hit states, Arizona and Florida, have yet to do so. Several major chains, including Walmart, Sam's Club, Target, Kroger's, and CBS, have announced that they will now require their customers to wear masks or face coverings. Natalie Brand is at the White House with the latest.
CBS News has learned the president spoke with Dr. Anthony Fauci on Wednesday night. The phone call was their first conversation since June 2nd. It appears the president may be trying to distance himself from White House officials' attempts to discredit the highly respected infectious disease expert. In an InStyle magazine interview with CBS Evening News anchor Norah O'Donnell, Dr. Fauci described himself as apolitical and said he doesn't like being pitted against the president.
The administration is also facing questions about a new directive that hospitals bypass the CDC and submit COVID-19 data directly to Health and Human Services.
The change has raised concerns about transparency to the public and the data being politicized.
HHS is CDC and CDC is HHS. This is something we should be celebrating, which is we're identifying a problem with our public health data infrastructure, and we're solving it to get that information.
Lawmakers are preparing to return to Washington. Pressure is growing for them to finalize additional coronavirus relief legislation. Extended unemployment benefits are set to run out later this month.
I think what we'll do is put a more prudent cap on them at perhaps 70-75% wage. So we create incentives to work, not disincentives.
Speaker Nancy Pelosi Thursday again called on the Republican-led Senate to take up the $3 trillion HEROES Act that the Democratic-led House passed 2 months ago.
Mr. President, admit it. You've gone down the wrong path. Ask for direction.
Senate Majority Leader Mitch McConnell has called the House bill a non-starter, but said lawmakers will be working on a new package beginning next week.
And Natalie Brand joins us now from the White House. Natalie, always good to see you. So tell us about Dr. Fauci's current standing within the administration.
Well, Lana, there seems to be an effort among the White House to kind of wind down these tensions. Our Paula Reed learned earlier today that the two spoke for the first time in more than a month, and Dr. Fauci declined to comment on the contents of that conversation, but a senior administration official told CBS that the president characterized the call as good and friendly and stressed that they have the same shared goals. Now, Dr. Fauci himself was recently on a Facebook Live with Mark Zuckerberg. He was not asked about these tensions, was not asked directly, and did not bring them up. He stuck to talking about science and the public health concerns, especially in the states where we're seeing surges. But Dr. Fauci really did seem to open up in this new interview with Norah O'Donnell, published in InStyle magazine. She asked him directly about his relationship with the president, and he said, you know, it's complicated because in some respects I have a very good relationship with him. During the times that I was seeing him a fair amount, it was quite a collegial relationship, and in many respects it probably still is, but I don't see him very much anymore. Norah asked, why do you think that is? And Dr. Fauci said, I think the tenor of what goes on in the White House has changed a bit. It's very much now focused on reopening. There's a lot of attention being paid to economic and other advisors. So the task force and the doctors still meet regularly. We still have a very close, almost daily relationship with the vice president, seeming to indicate there that his relationship with the president is more indirect right now and kind of goes through the channel of the vice president. Now, just yesterday, we heard Vice President Pence call Dr. Fauci a valued member of the coronavirus task force team and said he could not be more grateful for his steady counsel. But this all comes as tensions really reached a head earlier this week when that op-ed by trade advisor Peter Navarro was published criticizing Dr. Fauci. Lana.
Yeah, well, hospitals have also been ordered to bypass the Centers for Disease Control and Prevention when reporting their COVID-19 data. Tell us, Natalie, how is that being received?
Well, there's a lot of concern by experts. The White House had said that this is a move to streamline processes and avoid duplication. They say a lot of this information goes to multiple government agencies. But health experts speaking to CBS point out that the CDC has really been the central go-to repository for information, data points on different viruses, and in this case, the coronavirus, so that they can analyze trend lines and also make that information public. So experts we've been speaking to that have spoken to CBS and CBSN are raising concerns about transparency. Now, the White House has been pushing back and saying that there's not going to be a lack of access and that this information will still be available, but a lot of people are going to be watching to see if that's the case. Their argument is that this is going to get the information to HHS faster so they can identify hotspots, especially as task force officials are trying to surge materials and supplies and personnel to the states that are really hurting right now. But again, a lot of people scrutinizing this decision and also questioning the timing and wondering if politics may be at play, according to the critics. This comes just 1 week after we heard the president publicly criticize the CDC guidance, again, last week regarding schools reopening. So this comes as there have been these tensions between some White House officials and the president and some of the government's top health experts.
Yeah, we know that in some other countries we have been reporting on some of the problems when politics come into play when reporting these numbers too. So definitely hope that that is not the case. Natalie, you also mentioned that lawmakers are facing pressure to take up coronavirus relief legislation. Where do things currently stand on Capitol Hill?
Well, they're going to have a lot of work to do when they return to Washington, D.C. next week. And Senate Majority Leader Mitch McConnell indicated that Senate Republicans would really get to work on this new round of relief legislation. In recent interviews this week and going back weeks, he's really stressed liability protections for hospitals, schools, and businesses as a top priority for him in this new round of funding. He also said it would focus on schools, health care, and jobs. But we know, again, this comes after the Democratic-led House already passed a sweeping bill, trillions of dollars, $3 trillion, that it's very broad in scope. So now the question becomes, how can these two sides negotiate? Speaker Pelosi stressing protections for workers and an OSHA provision. So we'll have to wait and see whether the issue of liability protections becomes a possible sticking point, and then also the negotiations of how much more funding goes to not only individuals, but then also states and local jurisdictions who have requested help and obviously face challenges ahead since this pandemic is still raging in a lot of places around our state. We've heard from some Republican senators who have said they still want a better idea of how the previously allocated money that's gone to states and local jurisdictions has been spent. Senator Rick Scott of Florida writing to the Treasury Secretary today to ask that question. So we know that there are still some Senate Republicans who want to wait and see, whereas Democrats are saying that there is a big cost in delaying any further relief, and they really need to get to work immediately.
All right, Natalie Brand of the White House, thank you.